This webinar is part of the Community Collective Impact Model for Change initiative. We are funded under the 21st Century Cures Act as part of Ohio's response to the opioid crisis. The goals of this grant are to prevent opioid use and abuse, reduce opioid-related deaths, and increase access to treatment, including medication-assisted treatment. If you would like more information about the Community Collective Impact Model for Change initiative, please visit the website. We also right now have 12 funded communities in Cohort 1, and Cohort 2 has 8 funded communities, so we are touching 20 communities under this initiative. You may be wondering what the webinar series is and how it's a little different than the mandatory webinars that we do as part of training in our learning communities. And this is just to bring together those in the field to share their experiences, successes, any additional nuggets that may be helpful. We try to have a different subject every week or 2 weeks, and we hope that this helps our communities when they're going ahead and doing their strategic plan maps. So today's webinar, we're really excited. Tessa Miracle, who's a SPF Rx consultant, is going to be talking about Ohio's prescription drug disposal locator. And I know a lot of communities were interested in hearing about this for some of those strategies for their prevention plans, those demand reduction and supply reduction plans. So I'm going to go ahead and turn it over to Tessa, who is also working with our Collective Impact Cohort 2 communities. So good morning, Tessa.
Well, good morning, everyone. I apologize. I think I just turned my mute on just a moment ago. Hello. I just want to say thank you for spending this time with me today. I'm Tessa Miracle. I'm the evaluator for Ohio's Strategic Prevention Framework for Prescription Drug Misuse, which is a mouthful, so I say SPF Rx. I'm here to talk about a tool we've developed with coalitions and organizations just like you, for coalitions and organizations like you. I really want to emphasize as I talk today that this tool was created for our coalitions in the state of Ohio. So if there is something missing, something that you would like to see changed or added, I'd love to hear from you and ways we can make this more robust for your work. And so I do want to talk first a little bit about the background of Ohio's Strategic Prevention Framework for Prescription Drug Misuse, just so you can understand, where this tool came from and sort of who developed it. So it's just a really quick background. Ohio is one of 25 states with a SPF Rx grant. This funding was obtained by the Department of Ohio Mental Health and Addiction Services from SAMHSA. And we have key stakeholder organizations that have been able to guide and inform our work. So we have, obviously, the Department of Ohio Mental Health and Addiction Services, the Department of Health, Department on Aging, our Pharmacy Board and Medical Board, as just a few of our partners who are involved in this work. And we also have some coalitions that we have been able to bring into our work and inform our strategies. And our work is really focusing on the 3 pillars of prescription drug misuse prevention and environmental strategy. So we focus on safe prescription use, safe prescription storage, and safe prescription disposal. Within our project, we really wanted to focus on raising awareness about prescription drug misuse, working with our pharmaceutical and medical communities on the risks of overprescribing, the importance of safe prescription usage, storage, and disposal, increasing the utilization of floors in the state of Ohio, and enhancing infrastructure and prescription drug misuse prevention throughout the state. Now, really, when we were working with our stakeholders, we found a project that addressed multiple focus for us. So we really wanted to emphasize access to proper prescription disposal and also enhance our infrastructure around prescription drug misuse prevention. And that's how we had the idea for OhioRxDisposal.com. You are more than welcome to follow along with my voice and click through the website, but I also have screenshots for you today so you can see what it looks like because we want you to become very familiar with this tool. Ohio's disposal locator, or as I call it, the Google Maps of prescription drug disposal, is the first screen when you see when you log onto OhioRxDisposal.com. On this screen, you're able to enter your location. You can search by radius. If you are not comfortable driving more than 10 or 15 miles, you can find hopefully a location close to you. And then you can get turn-by-turn directions to a permanent prescription drug disposal location near you. We also recognize that not all of our community members are comfortable going into a police department. I always joke that I kind of sweat when I see our friends who work with us who are on the police force, and I've never even had a speeding ticket. So we recognize that not everyone's comfortable. So you are able to filter the pins around you by police department and non-police department. So as we log on, we're immediately met with Ohio's Rx Disposal Locator map. This map includes permanent prescription disposal locations in the state of Ohio. This map is continuously updated. So we have done a few separate assessments, and we've done a lot of outreach. And there is an opportunity for you to build on this map that I'll talk about a little bit later. After you are able to locate the pin that is closest to you, that you're comfortable going to, you can click on that pin and you can access turn-by-turn directions to the location of your choice. You can send these directions to your phone, you can print them, or you can email them to yourself. So we wanted to make them very accessible for folks. But as we were working, we realized it wasn't fair just to give people all of the locations in the state of Ohio. We also wanted to provide some resources because we recognize not only our partners, but partners in prevention throughout the state of Ohio were hard at work on toolkits and resources for you all to implement. And we thought it would be nice to sort of bring them all together so you had a one-stop shop if you were working on prescription drug misuse prevention. So the next tab on the site is our resources tab, and it includes a drop-down menu. And the first tab that I'm going to be talking about is the resources tab. The resources tab provided in this section include the statewide public health campaign from the Ohio Department of Health, Take Charge Ohio, which has recently been updated to include vignettes and videos. There are resources to work with prescribers. There are resources to work with family members. So there's a very robust array of resources for you there. We also added the employer toolkit from the Ohio Chamber of Commerce, and as well as links to the Be Present campaign, because we recognize that when people start into this work, we often want to involve youth, and we wanted to capitalize on an existing statewide campaign for our youth that is evidence-based. So the next portion that we wanted to provide for you after we started looking at our resources, we were thinking, well, how are people going to get the message out, especially our coalition members? The cheapest way is really social media, and I don't know about you, but I get a topic in mind, and I think that I want to share a message and recognize that maybe the words don't flow very easily. Maybe, I start questioning myself, and it takes longer than I intended, and I get a little frustrated. So we created a social media kit for you all. There's sample social media messages that are designed to increase awareness. We ask that you personalize these messages. We want you to add your coalition hashtag or any branding that you would like. And the only request we have is that you use the hashtag OhioRxDisposal. This greatly helps us in our evaluation so we can see the reach of it. So you can see we have sample messages for just general coalition or community messages, as well as messages focused on DEA Take Back Day that also include the link for finding those sites that are not open year-round but are specific to that day. Now, we began looking deeper into our work and realized it wasn't fair just to hand people social media messages and a map and say, hey, go do it. We recognize that not everyone else in the state of Ohio has access to a prevention specialist, or maybe some of us are new to prevention, or maybe we need a resource that we can guide some of our partners who are new to get them sort of onboarded so they can feel included in our work. So the Community Action Center was developed for communities like you. We have lists of risk factors to address with sample interventions that are evidence-based, example policies that limit access to prescription drugs, as well as possible activities for you to use in your community. And we really want to empower your work with evidence. So again, if this is Ohio's tool, and we want to create something that you will love and use each day that you are working on this topic. So if there's something that you would like to see added, I'd love to hear from you. Now, while we're mobilizing our communities, we're giving them evidence and we want them to take action, we recognize that you may want to print some resources. You may want to print some flyers, some door hangers, some stickers to work with your pharmacies and things like that. So we went ahead and we took a little bit of that lift for you. So we've created sample flyers and stickers. We're always adding to this. Just last week we were asked to add a sample banner to our printable resources. We recognize that a lot of our coalitions are built of folks just dedicating their time for free. So we want to make sure that while you're doing this, you don't have to worry about the expense of hiring someone to design something for you. So we created resources that you are able to personalize. We intentionally left white space on all of these designs so you can brand them with your own logo. And we would love to hear from you if, about resources that you would like to see added. As you can see, we have a few different resources. One of them is a color flyer that's designed more for awareness, one that we would really like to target adults with. Another one that's black and white. Again, we have a lot of white space. And also our last flyer really targets those organizations who are partners in prevention who maybe are opening a new prescription drug disposal location. And so it informs them of how to let us know to add their site to our map so we can get them involved with us. One of the biggest barriers we face with prescription drug disposal is knowing what we can dispose of and what we should dispose of. We've heard from the Environmental Protection Agency that there's a little bit of conflicting information going around out there that, sometimes people are told they can flush medications that are not necessarily safe for our water supply. So we wanted to include frequently asked questions, and we also wanted to include resources that would help our community members dispose of medications safely and effectively. So just a few sample FAQs for the page is, so people can understand what prescription drug misuse is, what they should dispose, or why they should dispose of medication, and what they should dispose of. So the list can be a little surprising for some of our folks. It includes obviously narcotics, opioids, things like this, but also some of our over-the-counter medications are not safe for the water supply, as well as vitamins. We don't think of things like that as being at risk for diversion or risk for the water supply, so we wanted to increase a little capacity there. We are also working with the Ohio Environmental Protection Agency to include information on proper disposal of sharps, which is one of the next items we are working on with SPF Rx, is making sure that those items are also safely disposed of. The disposal FAQ page includes links, answers to our questions, as well as a contact link in case there was a question we didn't think of. We'd love to hear from you, because if you have the question, I can guarantee you more people have the question. Now, as you're looking at our map earlier, I know some of you may have started clicking through with your own community address and realized, hey, I think that pharmacy on the corner of the road they have a disposal location and it's not on this map. In the state of Ohio, permanent disposal locations are opening every day. And some of them, unfortunately, have closed or moved. So if we missed one in your town, you can use the Submit a Location tab to add new locations to the map. So we just ask that you include the location name, their street address, city, state, and zip code, if possible the website, and submit the location. After we receive this information, we then call the location and geocode them and add them to our site. We have called all of the locations to be added to our site to ensure that they are willing that their information is shared in this manner. Now, if you are clicking through our map and you looked and you realized maybe a disposal location wasn't close to you, we recognize that you are not alone. During our assessment, we realized that over 15 counties in Ohio did not have access to permanent prescription disposal locations. Now, our assessment was back in 2017, and that number has severely decreased. So we recognize more and more folks are having access to permanent prescription disposal every day, but we also recognize that not everybody is able to access those disposal locations. So if you are a community member, find yourself sort of in that space where you aren't close to a disposal location, or maybe the one that's closest to you is one that you're not comfortable going to, you can request a prescription disposal pouch be sent to your home. This pouch is sent free of charge, and it includes an evaluation postcard that we just ask that you return to let us know, what you disposed of, how quickly you used it, and how the experience of disposal went for you. To request a disposal pouch, we just need your name, your email address, and your street address. We will not sell this information or use it for anything other than to ensure that this bag is sent to you and that you receive it. Now, Ohio's Rx disposal locator tool is developing every day, and our goal is for this to change and grow with Ohio's needs. So our next phase, we would like to map prescription disposal bag programs throughout the state to make them easier to access for folks, and also to support collaboration for some of our community coalitions who, may share a border with another coalition working on this, so you can, increase your capacity there. And then we're also working to promote prescription disposal bag use through local television stations and radio stations. So with that next phase in mind, I want to say that we need you. If your coalition offers prescription disposal bags or pouches and you would like your work promoted on OhioRxDisposal.com, just use the contact form at OhioRxDisposal.com, and we will reach out to you and make sure that you are included on that next phase of mapping, because we want to promote your good work. So my last slide for you is my contact information. I would love to hear from you if you have any additional questions or thoughts of things you would like to see added or removed. I'd love to hear from you. And before I close and open up for questions, I just want to say a big thank you to the Department of Ohio Mental Health and Addiction Services, because without their generous funding and guidance, this tool would not be possible for our coalitions throughout the state. So with that, I have quickly gone through the disposal site for you, and I'd love to hear your questions for me.
Thank you, Tessa. That's great resources. Thank you for walking us through the website, kind of the future of where you're taking the website. I think that gives our communities a lot of great information. We're going to open up for questions now. Feel free to go ahead and type them in the chat box, or unmute your phone line and go ahead and speak into the phone, whichever way is easiest for you and which way you feel comfortable. See a few communities typing, so we'll just give them a few seconds here. So Charlotte is asking, she says, thanks for the resource. I can see it's been a great addition to our new website. Are we allowed to link?
Hi, Charlotte. Yes, we would love for you to link it on your site. And, we would love to hear more about your initiative, because one of the focuses of Ohio SPF Rx now is we are starting to promote communities and their work in this area. So as you link, if you'd like to be featured in our newsletter or on our site, just reach out.
Charlotte says thanks, and we'll go ahead and link to this website as well on the Collective Impact website. Just in case you go there for these resources, you can go ahead and link out to the SPF Rx website as well.
Great, thank you.
And I see more communities typing, so we'll wait for a second. Stacy asks, will the website continue to be updated once the SAMHSA funding stops flowing for the project?
That is the plan right now, that the site will continuously be updated. Right now, we are working on sustainability for that. So currently, sites that are included on our website, what we did was we sort of compiled that master list of disposal locations and called all of them to ask if they were interested in being included. Now, I will say the majority of them said yes. And then quarterly, we call back to make sure that the disposal site is still open. So we are working on a sustainability plan to ensure that and more of a relationship with all those disposal locations so they can answer electronically, so it doesn't require as much manpower in the future.
Looks like we have a little bit more typing going on. We'll wait for a second there.
You guys are so fast. I know that it would take me a lot longer, so I'm impressed.
Especially on a Monday, right?
Exactly.
Stacy is asking, how has SPF Rx communities promoted this resource to date? The toolkit seems very helpful.
Great. So how we've worked so far is sharing this within our communities who are already working on this work. So SPF Rx is a little bit different than SPF or SPF PFS in that we have only funded one sub-grantee community, and they're really working on infrastructure at this moment. So we're really working across the continuum of care and also trying to break down some of our silos to make sure that our medical community are promoting this. We've recently brought in veterinarians. So we're really working on sort of an environmental approach with this. And our involved partners have promoted this on their website, have included it in, if their organization promotes events on social media or, shares any information on social media, they have shared this there. And then we also have a few partners that we're working with to see, excuse me, to see if we can add this at the bottom of receipts in the future. So we have some partners that are implementing in very different ways.
Stacy also wants to know if there are any user restrictions for the social media or toolkit content. No, we don't have any. We don't have any restrictions at the moment. We put it out there for folks to use in line with proper prevention practices, but there are no fees, no limiting factors for use at this time. And thank you, Stacey. I'm so glad you're so excited. Yeah, it sounds like you've had communities using the resources in a lot of different ways and being really creative when it comes to getting these out there. So that's good to see as well. We have time for a few more questions if anyone has any.
And, I will say I overlooked one way. So a couple of our communities who already host parent nights or parent educational series, such as in Springboro City Schools, they offer, I think it's like a quarterly night where they bring in a speaker for the parents to talk about issues impacting parents. They have shared this information with parents that way, and through through newsletters that they send home to parents. So if you are looking to work with your schools, that might be a helpful way to get involved with them.
Thanks, Tessa. And I know a lot of our communities have chosen to focus on youth and their demand prevention plans, so that would be a good area to check out as well.
Great.
Yeah, of course. Are there any other questions for Tessa?
Well, I do want to say thank you to all of you. Your questions have been great. If you have any, if you're driving down the road later today and you think, oh, we should add this, this item to the disposal site, or if you have another idea for a partner, I'd love to hear from you. My contact information is in the slides. It's also, this this grant is my full-time job. So if you have a group of stakeholders together and you'd like someone to come out and talk about the site or, you know, show them electronically, I'm more than happy to meet with you and support your needs in any way I can. But I really appreciate your time and attention today, and I hope you all have a wonderful Monday.
Thanks, Tessa. And we're so excited that you're joining us for the cohort 2 of the Community Collective Impact Model for Change. And you'll bring a lot of great insights and resources to that group as well, and to the website.
Thank you. I'm thrilled to join you all. Thank you for having me.
So with that being said, we're going to go ahead and wrap up this webinar today. But if you would like a copy of the presentation and you have not already done so, please type your email in the chat box. The recording of this webinar and the slides will be posted on the Collective Impact website. And again, thank you to Tessa. And stay tuned for more information on the next webinars to come. We're trying to get some things finalized there, but we'll get all the information out to you as soon as we can. So thanks, and have a great rest of your week.